So hi and welcome guys, I'm a third semester BSc Nursing Student at Howrah District Hospital, and this kind of video is a bit different in my channel. So today I'll be sharing, as you've seen in the thumbnail, that I'll be sharing my OT experience as I'm posting in the OT for a few weeks now. So it's been a drastically high on emotions experience in my OT basically. So it was yesterday. A mother of 21 years old came basically with who was about to undergo a cesarean section or C-section delivery. Basically, she can't have a normal delivery due to some complications, and probably the complications were I remember it was baby breach. So what was basically it was baby breach. So what is baby breach? Now, breaching of the baby is kind of like feet is first. It's a C-section for you guys. C-section is a cesarean section delivery. It is a surgical procedure basically where baby is born through incisions in the mother abdomen and the uterus used in the vagina. What is risk or impossibility of complications? Like breach, as I said, that the position is not proper. Fetal distress or placental issues. So sometimes it can be planned. It is like planned convenience for delivery. Right? It's generally safe, but involves major surgery, requires longer recovery and carrying lots of infection, bleeding, and longer healing in vaginal birth. But in cases like when normal delivery is not possible, hence there is a cesarean delivery, as we people know. So I'm about to share my experience, my first ever experience, as we're not allowed to like capture, so I can't, like, you're not allowed to share this personal information as it falls under medical legal issues. So now we went, and I'm kind of nervous when it comes to blood and all this stuff, right? So I entered the OT and I got to know that there are cesarean sections, and I was very much astonished to see, like, visualize a scene where the baby is coming out from the abdomen and all of that. I was so fascinated to see that. First they sat and they like inserted this much big needle in the spinal cord. They inserted it and they pushed the anesthesia. The patient was very, very, very calm and composed. She was laying there, she was staring. She wasn't feeling at all nervous, though it was his first child. Anesthesia was pushed. Patient was calm, laid down, got ankle tissues, and then they started curing it with hands. Like they literally did, like cured it with hands. Wait, sort of this. You can visualize, I guess. So they cured it with hand, and yeah, actually, I remember what's that. That is the word that English visual goes. Okay, man. Then pulled the baby like a living chicken. Like chicken, they pulled it. Yeah, with the legs. So first they like pulled it with the legs, and then they one senior doctor was present, and they like put the how do I make you understand? Like they just pulled it like a chicken. That's all I can see. Right. So yeah, it was a baby boy. It was a baby boy, and then the suturing, then they like put the uterus and all. The placenta was removed. The placenta was cut. It was removed like an irrigation. They like it was inserted an IUD, copper IUD. Okay, so they put they like brought the uterus out of the abdomen and they cut it, tore it, like then implanted the IUD and all. Then they sutured the uterus again. Then they put the uterus in the abdomen. Then they sutured like the abdomen and all that. Then it was like they like inserted like their hand and all. Like they always checked that if there are any lumps, any bleeding there. So they like pushed it, and the visual was so scary, so creepy. I say, you guys, they stitched it back. They put the everything was done, and I'm still shivering. Like it feels like it's happening in my abdomen. So it was a wonderful experience. And today I observed a catheter surgery in the ED of the IUD. It was nice, but I have some doubts and questions about these. What is the procedure? I said you guys, like first it's anesthesia, then it's infusions in the delivery of the baby, and then is the closure of the uterus and abdominal layers stitched up. Duration, it basically takes 45 minutes, but like under supervision of the senior doctors and all, it will take 45 minutes only. But the like stitching part is a bit tricky one, so they always confirmed like there is no lumps, there is no bleeding, internal hemorrhage, or all of that. So it takes like 1 hour. Recovery and risks basically. What is the immediate recovery? Yeah, another experience I would like to share you guys. I took the baby in my hand, I breastfed the baby with like they held the mother, like I held him like this for the first freaking time in my life. I held the baby like that, and I took the mother, breastfeeded her. Sorry, him, it was a baby boy. Breastfeeded him like, it was so exciting. I see you guys, it was so exciting. Very long day, but I feel so happy that I witnessed it. There wasn't any complications, there wasn't any rare issue, there were normal basic delivery, but I felt like it was the first time I've observed anything called OT. There's a phobia. I had a phobia like with this hospital and all this stuff, and this is OT, freaking OT. I assisted OT, and that was cesarean section. Cute CV by Kiran. It was wonderful. I see you guys, this field is filled with toxicity and all, but when you just see patients happy, feeling is out of the world. So that's it for the video. Thanks for watching. Follow for more. Bye.